Hi there, I'm Dr. Alex Veazey. I'm a consultant vascular surgeon with a particular interest in treating varicose veins, and I wanted to make this video to talk about one of the more popular treatment options known as endovenous radiofrequency ablation, or RFA for short. Now, I know that might sound a bit technical, but I'm here to walk you through what it is, why we offer this method, and what you can expect before, during, and after the procedure. This essentially refers to operating within the vein to seal it off. It's sometimes also referred to as the keyhole approach. When we are operating inside the vein, there are two classic ways we can go about delivering the treatment. The options are that we either use radiofrequency or laser energy to treat the inside of the vein. Both radiofrequency and laser methods have similar levels of effectiveness, but we have chosen to offer radiofrequency in our practice because research shows that it tends to have fewer complications and a slightly more comfortable recovery for patients. The goal of the procedure, however, is just the same: to deliver thermal energy, in other words heat, to seal off the main diseased vein so the blood can be redirected to healthier veins, ultimately improving your symptoms and the appearance of your legs. We'll start with a consultation where we'll discuss your symptoms, review your medical history, and perform an ultrasound scan to map out the veins we'll be treating. This helps us ensure we're targeting the right veins and allows us to plan the procedure with precision. On the day of the procedure, you'll come to the clinic and we'll make sure you're comfortable from the moment you walk in. Our friendly team are experts in doing that. You'll be taken to the operating room and I will begin with an injection of local anaesthetic just below the knee. We then use ultrasound guidance to insert a thin catheter into the vein. When we've confirmed that the catheter is in precisely the correct place, we then inject cooled local anaesthetic fluid along the length of the problematic vein, usually in your thigh. This serves to numb the area and protect the other tissues in your limb from the thermal energy that we use to seal the vein. When you're ready, we then use the catheter to deliver radiofrequency energy, which heats the vein wall, causing it to shrivel and close off. The whole process usually takes less than an hour, and because it's minimally invasive, you'll be able to walk out of the clinic on your own shortly after we're done. We'll ask you to wear a compression stocking or garment for a week or so to help with healing, minimize swelling, and promote good circulation. You may experience some mild bruising or soreness, but this typically resolves quickly. Most of our patients are pleasantly surprised by how little discomfort they feel and how quickly they can get back to their own normal activities, often within a day or two. There is a newer alternative to radiofrequency ablation known as the VenaSeal procedure, which requires fewer local anaesthetic injections and does not require you to wear a compression stocking afterwards. In terms of long-term outcomes, radiofrequency ablation has a very high success rate, with most patients experiencing significant relief from symptoms and a noticeable improvement in the appearance of their legs. Over time, the treated vein is reabsorbed by your body, and the blood naturally reroutes to healthier veins. The recurrence rate is around about 5%, or 1 in 20, similar to most of the endovenous techniques available. If you have additional small veins below the surface of the skin that are not improved by treating the underlying vein, we typically treat these using either phlebectomy or foam sclerotherapy. We'll schedule a follow-up visit to make sure everything is healing well and to answer any questions you might have as you recover. Our priority is your comfort and satisfaction, and we're here to support you every step of the way. If you have any questions or concerns, please do not hesitate to get in touch.